Hello, I'd like to thank Ashley and the Sharp End Podcast for having me on today. We are going to discuss the podcast that took place in Norway where the skier fell down and went over the cliff. So we're going to talk about traumatic brain injuries, otherwise known as a TBI or a concussion. In the United States, there are 2.5 million TBIs per year, and this number is very low compared to the actual number. How many of you have actually fallen and hit your head, bumped your head during a sporting event, or seen one of your kids bump their head and had that reported? Most go unreported. A traumatic brain injury is disturbance in the brain function caused by an external trauma source, not necessarily causing loss of consciousness. So sometimes we fall, we hit our head, we remember everything, and sometimes we don't. The first thing to go in a TBI is the recollection of the actual events, and that was demonstrated in this podcast. When he got to the bottom of his fall, he did not know who he was with or where he was, and that is very common of a TBI. There are many symptoms associated with a TBI. You can certainly have a headache, you can be dizzy, nausea, vomiting, memory loss, poor balance, seizures. Some people even become very combative, and of course the end result is you are unconscious. This is a very serious injury. When we talk from a search and rescue perspective, we always refer to life threats. A head injury is a life threat. And these symptoms seem like they make sense as long as you're witnessing the event. But what if you were on a trail and you came across someone lying on the ground, maybe at the bottom of a crag, or maybe just off of a trail? He may have a traumatic brain injury, but he may not. He may just have altitude sickness. He may be hypothermic, being cold, or hyperthermic, being too hot. He may have a medical problem. What if he spent the night out last night and was diabetic and didn't have his medications with him? Or maybe he had a seizure disorder and he did not have his medications with him. And the big one to remember is shock. Shock comes in many forms, and if you're losing a lot of blood, you're not going to perfuse your brain, and therefore you are going to present similar to a brain injury. So the key to this is knowing how to evaluate somebody and having a plan. I would encourage all of you to take a wilderness first aid or a wilderness first responder course. This is going to give you the tools necessary to learn how to evaluate somebody. And that consists of a primary and a secondary survey. And basically you're trying to rule out life threats. If someone has a traumatic brain injury but has a significant blood loss, the brain injury is not going to matter at the end of the day. If someone has a respiratory issue and can't breathe, that's going to take precedence over a traumatic brain injury. Often associated with brain injuries is a neck injury. So it's always important to examine the neck and talk to the subject about having neck pain, and then provide some stabilization to the neck. In recent times, we are no longer using C-collars for all neck urgencies, and most likely you won't have one with you. And that's just where towels, jackets, backpacks can certainly help stabilize the neck. And so these are things you need to be concerned about, because if you miss a life threat, the brain injury is not going to be an issue. Alternatively, if you miss the brain injury, that's a significant issue. And we see this in sports at younger age children. They have a brain injury, but because they didn't lose consciousness, the coach did not realize that they had a brain injury and puts them back in the game. This can lead to prolonged physical and psychological issues down the road. So it's very important to realize that someone that is not acting normal needs to be identified. And sometimes if you don't know that person, that's very difficult for you to tell. So today we're going to talk about how to identify someone with a head injury. And we're going to use something called the AVPU scale. I'm teaching this on a first aid level. Those of you that are in the medical profession agree that we could talk about traumatic brain injuries for hours, and there's multiple different scales we can use, but they are very complicated. I want the average person out hiking or skiing to remember this. So AVPU, we look here at alert, verbal, pain, and unconscious. And what I mean by that with the A is you're alert. You can carry a conversation with the subject, they're responding appropriately, and you do not notice a big difference in their personality. Verbal is more, you have to really get their attention. The analogy I give is I'm trying to watch a football game and a family member is trying to get my attention. Sometimes they have to yell my name a couple times before I pay attention. That would be verbal. The next is painful. So you've tried having a regular conversation, you've tried to communicate using their name, and they're still not responding. So now you have to do a sternal rub, which is where you take your hand and you rub on the center of their chest, or maybe pinch them and see if they respond. The last is they are unconscious. And if they're unconscious, they're not responding to anything. As we work through this, A is a mild concussion. The V and the P are moderate, and the unconscious is obviously significant, okay? So you have to take this all into account. When we think back to the podcast, we know we had multiple injuries, which we will cover in another episode of this, but think about just the brain injury. He was lying there on the snow, and he didn't know where he was, and he didn't know who he was with. So he was alert, he was functioning. We don't really know how he responded, but we know he had a brain injury because he did not know the current events of what just happened. And like we stated at the beginning, that is the first thing to go with a traumatic brain injury. So as part of our evaluation, we're going to be continually talking to him. So once we've decided that he has a brain injury, we have to figure out how we're going to get him out of here. And that comes down to having a good communication plan. So if you're relying on just your cell phone, certainly you have to take into account the temperature and whether or not you're going to have service. Now, lots of the new phones have an SOS feature, and we have responded to many missions with this function. It basically connects to a satellite and gives us your GPS location. So it's important that you stay in that same location. Now, you may feel like you have to move because of the weather, and as long as it's still visible from the same spot, that is fine. But one of the key features in search and rescue is always stay in your same position. Satellite phones certainly are becoming more common, and many companies are starting to have that as an option, and that is great. I would encourage you to have at least a secondary option too, maybe a Garmin device or something that you can hit a button on that alerts EMS as far as there is an emergency. So once you have communication, then you have to have a plan. That can change based on the terrain, that can change based on the weather. Sometimes helicopters can't fly, sometimes search and rescue teams can't get to you, especially if you had to climb up and the weather is inclement. That creates an issue. Now, while you're waiting for the search and rescue team to come, it's important that you stay calm, and it's important that you talk to the subject. Keeping them calm is going to help keep their blood pressure down. Keeping them calm is going to keep them relaxed. And psychological first aid has been shown to reduce pain, anxiety at a significant amount, similar to certain drugs. So you don't have drugs, so the best thing you can do is distraction and talking to them about maybe their family or other things that would keep them from thinking about their brain injury. It's important that they stay rest. It's also important that you keep them from getting too cold. Certainly in this scenario, they're on snow, so you'd want to get them off the snow on a pad, and you would want to give them lots of layers. Remember, layers underneath are more valuable than layers on top, and that is important. So in this scenario, if he would have not had the other injuries that we know that he had, if he would have just had this head injury, he's probably a mild, maybe mild to moderate head injury. But why would we evacuate him if we are concerned? Some reasons to consider: if the headache is getting worse, more severe, if they start vomiting more and more, if they have neurological deficits, if you notice their face is not symmetrical, if you notice they can't use one hand or the other. If they have alcohol or drugs on board, you cannot do a normal neurological exam. So anybody with drugs or alcohol on board, it's important. The other thing to consider is medications. If someone is on a blood thinner, all injuries become much more serious. And then, as we mentioned before, if someone has other medical problems like seizure disorders, diabetes, or other medical problems, and they're going to go a night without those drugs, that can be very significant. The number one goal in a traumatic brain injury treatment is they need to get to a hospital. There's very little we can do in the field. There are studies that suggest we can elevate the head of the bed or the ground using a backpack to about 30 degrees, and that can decrease blood flow to the brain, which can be helpful. But other than that, they need to get out of there. So when you are planning a trip, make sure you know how to contact your local search and rescue department, and that varies in different countries. In the United States, search and rescue is always to the sheriff's department, and that is a 911 call. I can speak for Colorado. In Colorado, search and rescue is always free. That is not true in other countries, and that is not always true in other states, but that's important to know. From our perspective, we want you to call early. If you wait till it gets dark, or you wait till it gets too cold, it can take us a long period of time to get there. In this podcast, they said the helicopter was there within a half hour. That really doesn't happen in most search and rescue situations in the United States. We are typically all volunteers, and we have to get to the trailhead and then hike up to wherever you are. We do have helicopter options, but they're not as available as they're used in Europe. So when you're heading out for a trip, please make sure you have a plan, you have a phone number, you have a primary and a secondary communication system. Make sure you carry your 10 essentials. An individual first aid kit is important. Make sure someone knows what your plan is and when you will be back. And of course, stay safe out there. And I'll look forward to talking to you again when we talk about cervical spine injuries next time.